Hello, everyone, and good evening. At least it's evening here in London, where I'm speaking from. I'm Shoshana Boyd-Gelfand. I have the honor of being the chair of Alums International Advisory Board and also a member of the Paris Foundation team. Most of us who are on this call are blessed to live in countries where the COVID vaccine is readily available. But we know that that is not true for everyone in the world. You've just heard a lot about Shvita, which is primarily an agricultural concept, but it's a deeper concept in terms of Jewish tradition. It's about using our power wisely and ethically, and also realizing that the world does not belong to us. Just as we have an obligation to ensure that the land and its resources are shared equitably, we also have an obligation to ensure that the fruits of our other labors, such as medical breakthroughs, are shared. So for the next 30 minutes, we're going to be discussing one of the most urgent issues facing the world today, the vaccine to protect us against COVID. I'm so pleased that there are multiple alum partners who are doing excellent work in this area. We're shortly going to be hearing on the panel from Dr. Rafaela, who works for Israel in Eswatini. And here I can't help but give a shout out to the Kirsch Foundation, who have provided significant support for this vital work in Eswatini. And there are other alum organizations as well, such as Gabriel Project Mumbai, who have partnered with UNICEF to raise awareness and counter vaccine hesitancy in India, and American Jewish World Service, who are focusing their advocacy work on changing policies to allow even the most marginalized people to access the vaccine. They're also pressing the United States government to invest even more in global vaccine access. I know when I received my vaccination here in the UK, it was a moment where I felt such deep gratitude. I couldn't help but recite a blessing in Hebrew, a tova metiv, thanking God who gives us good things and does goodness for us. I was also grateful that as part of my role at Paris Foundation, I was privileged to partner with UNICEF on the UK's Give a World a Shot campaign. This campaign had multiple benefits. First and foremost, it raised funds to provide vaccinations to those who need them. Second, it encouraged people like me in that moment of gratitude to feel a sense of connection with people all over the world and to ensure that we realize and we internalize that we are all in this together. And finally, we think because of the social media element where people were sharing that they had made a donation after getting their vaccine, there's some preliminary evidence that the campaign decreased vaccine hesitancy here in the UK in certain areas, which was a wonderful, unintended, but welcome benefit. I'm going to say a bit more about that campaign and how you can get involved later, but I want to jump into our panel now. We have three extraordinary speakers who will update us and share what's happening around the global vaccination effort, along with what some of the ethical challenges are. Delighted to welcome Dr. Oren Levine, the Director of Global Vaccine Delivery at the Bill and Melinda Gates Foundation, Liz Case, the Senior Lead on Private Sector Partnership and Fundraising for Act A and COVAX at UNICEF, and Dr. Husna Dafala from Israel. And I have to just put in here now, because I was delighted to find out that she is a graduate of the Hebrew University Masters of Public Health as a Paris Foundation Fellow. And she is now calling in from the Kingdom of Eswatini, where she is on the ground working with Israel. I'm going to ask you each a slightly different question because I want people to get a sense of the magnitude of this issue. So Oren, if I could start out with you, what is the current status of vaccines around the world? We hear about CEPI and Gavi and COVAX and all of these different alphabet soup, but can you just give us an overview? What are the numbers? Who's getting vaccinated? Who isn't? And who's paying for all of it?
Yeah, thanks for the opportunity to be here today too. Look, it's remarkable to think that the marvel of science created vaccines against a pathogen that we hadn't seen, and did so in under a year. We went from sort of first identification of the virus to making a vaccine that actually protected people in under a year. And that's a scientific miracle. It's also unfortunately true that the rollout of the vaccine has been highly inequitable. And that's a part of the work that I spend a lot of time on right now. And I want to kind of illustrate for you. We definitely have vaccinated more people in the last year and a half than we've ever done before in that time frame. But it's been very uneven. More than half of the world's population has received at least one dose of COVID-19 vaccine. That's a good global number. But when you actually look at where those vaccines are being used right now, it's highly inequitable. We've got folks here in the United States that are getting their third dose. And yet, in low-income countries, it's less than 5% of people who've received even one dose. So that's a massive inequity in vaccine access at this point in time. The way that the vaccines are being financed is through a combination of bilateral efforts by countries themselves to buy the vaccines, through multilateral efforts, and Liz may talk a little bit about COVAX in her comments, but COVAX is a collection of the world's most sort of generous donations, either as vaccine donations or as financial donations, coming together to be able to allocate doses to many countries that can't or haven't had access to them, or would have a hard time affording them at the prices that are being charged in other places. So there's a global effort to pool resources, whether it's finance or excess donation of excess doses through COVAX. That is a big part of the solution. And if you look at COVAX right now as a source of the kind of total volume of doses going into countries, you can kind of conclude that it's a relatively small contributor right now, to be honest. But I think that masks two important points. One is we're at an inflection point right now on supply, where we expect 1 billion doses to be rolling out this quarter to low and middle income countries through COVAX. And two, COVAX represents about 90% or more of the total volume of COVID vaccines for about 50 of the world's low and middle income countries. So they are very, very intimately the primary provider of doses to those countries. So just a couple of quick background kind of numbers to illustrate both the inequities that we are facing today and the global response, both to date and the ramp up period that I think we're about to experience with 1 billion doses this quarter, and hopefully over 2 billion doses by the middle of next year.
Wow, those are staggering numbers. And if all of that isn't complicated enough in terms of how this global effort works, I know I have been on a steep learning curve over the past year in terms of the role that UNICEF plays. And so I'm delighted that we have Liz Case here, and she's going to explain a little bit to us about that collaboration between COVAX, what you just were explaining, Oren, and UNICEF. And I know I had some assumptions about UNICEF that just weren't correct that I've learned over the past year, and hopefully we'll be able to unpick some of those as well, because it has the UN in it. The connection between the UN and UNICEF was not clear to me. So I hope Liz will say a few words about that. as well as the relationship with COVAX. But I think we're going to start with just a very, very brief video that will set the stage for that. And then I'll turn it over to you, Liz.
What does it take to make history? What does it take to fight for equality? To race to bring a pandemic to a halt? A pioneering spirit, relentless innovation, 75 years of delivering results, a global network of partners, the passion of a team who will never give up. This is how UNICEF became the largest vaccine buyer and distributor in the world. This is how UNICEF helps vaccinate nearly half the world's children every year in the hardest to reach places. Our systems were made for this. Our people were made for this. We know we can make history happen. We can get the COVID-19 vaccines to at least 20% of the world's population, delivered to the countries that need assistance, for the healthcare workers and vulnerable populations, the people who need it most. But we need you, because history is not made just by one, but by the collective, by the choices we make, and by the partnerships we forge. Together, we can make this happen. Together, we can make history.
Well, thank you very much for showing that video. And I hope that seeing that kind of makes it easier for you to kind of picture what it is that UNICEF does. I mean, UNICEF is part of the United Nations family, but we are not funded by the United Nations. We're an agency that stands alone completely in terms of voluntary donations and fundraising. And something I discovered a couple of years ago that I thought was really interesting was that UNICEF was founded by Ludwig Reichmann, and he was a Polish-Jewish physician who after World War II decided he needed to support the establishment of an organization that took care of all the children that were impacted by World War II. And I have to say, we're still holding on to that mandate. We really just, our mandate is to protect children wherever they are with whatever they need. So I really enjoyed learning that. What we're doing in COVAX is a little different because of course, certainly in the most part, these are not vaccines for children. These are vaccines for adults. But when the pandemic hit, we knew as UNICEF that the best possible thing we could do was to step up and bring the expertise we already have in routine immunization and the cold chain we have all over the world, the systems we have, and bring it to bear with the World Health Organization, with Gavi, with CEPI, with all these partners that are part of COVAX. And we've come together to try and make sure these vaccines get where they need to go. And the freezers and the cold chain and the personal protective equipment and everything syringes that need to go with that. That's what we're doing. So UNICEF's role is the lead procurement coordinator for all of the vaccine rollout for COVAX. And as Oren said, that's going to be between 2 and 3 billion vaccine doses, hopefully by the middle of next year, with the syringes. Now those are paid for by generous donors in high income countries, and they will go to the lowest and low middle income countries that need support, and they will get to the capital cities and the port of entry in 100 countries around the world. And then we also have a role as UNICEF there in making sure and helping our partners, when there are many partners on the ground, and governments get these vaccines and turn them into vaccinations. Because once they arrive, that's just the beginning. And we have to make sure that then people can get vaccinated. And I know that Dr. Husna will be saying a lot more about that when it comes.
Thank you so much, Liz, for that. And I had not realized that the origins of UNICEF. I'm very touched by that. And now we're going to hear from Husna, who is a medical doctor who has worked on the ground in various countries, in Kenya, in South Sudan with the World Health Organization. And now she is currently calling in from the Kingdom of Eswatini on behalf of Israel. And Husna, I think from you, we'd just love to hear, what is it like on the ground in terms of trying to deliver these vaccines? What are some of the challenges, and how have you been able to overcome those obstacles if you have, or what would it take to overcome them?
Thank you very much, Shoshana, for the question and for the invitation to this panel. Greetings to all viewers, participants, and listeners. Part of the challenges we're having on ground is in terms of planning and coordination that needs to be strengthened. So part of what IsraAid and UNICEF and WHO and all the other partners, it's a long list, contributed to addressing this challenge by the bottom-up approach, by conducting regular meetings and planning of vaccination activities with the regional representatives and vaccinators on ground. There's also an upcoming interaction review whereby we will be updating the partners' profile and have a unified activity dashboard with accountability framework. Other challenges that were mentioned by my colleagues here, Liz and Orion, is the ultra freezes and the limited knowledge on the storage of and handling of Pfizer. What we did on ground is we conducted capacity building for the Central Medical Store staff with UNICEF and other partners, and also availing and maintenance of the cold chain. Also, some of the other challenges we had is accessibility. We've had 6 sites that are very far from the communities. So what we did was we came up with a strategy by bringing the vaccines closer to the people, of course, by multiple supports from partners, and by also integrating the COVID-19 vaccine into routine services, such as having those vaccines in the antiretroviral treatment clinics, in the non-communicable disease clinics, pharmacies, and private clinics. We've also established mobile vaccination sites. We have that in churches, mosques, and other private sectors as well. Next week, we'll be having mass vaccinations, of course, with in alignment with the WHO infection prevention and control guidelines to observe distancing and all that. So the mass vaccination will be ongoing for 2 weeks. So we're planning to reach more people. Other challenges also when it comes to communication and awareness is that from the beginning of the pandemic, there was the COVID-19 risk perception has been low among the population and including healthcare workers. So what we did with partners here is to address that by providing health education sessions on the benefits, safety, effectiveness of the vaccine, and also providing information on the advanced events following immunization. We've also engaged influencers, religious leaders, community leaders, and other entities. We've also strengthened the feedback communication mechanism, whereby we have health alert apps, whereby members from the communities will text questions to those apps, and they are responded within 24 hours. We're in the pipeline of developing a rumor tracking tool, and that will establish a feedback mechanism back to the community. Over.
Wow, thank you, Husna. That just gave us a taste of some of the challenges really on the ground there. What strikes me from listening to all of you is how there is no single player, country, organization that can do this alone. The number of different, and not just the number of different organizations, but the number of different kinds of organizations and entities that need to cooperate to get the job done here is mind-boggling. I'm hard-pressed to think of any other global effort that has ever involved so many different entities. And all of the people who are calling in know how difficult collaboration is. It takes time and energy and resource and a whole lot of goodwill. So I wonder whether you could share with us each from your slightly different vantage points about how the various players in the sector are working together or not to ensure vaccine equity and access. There are deep ethical issues here. There are deep technical and logistical complexities. So can each of you just touch on it from where you sit? I think Oren, we'll start with you in particular. I'm curious about the relationship between philanthropy and world government. I am sure there are some people who think that the government should be paying for this and some people who think philanthropy should. And are people playing nicely or not?
So a couple of points here. One is you're absolutely right that it's going to take a whole host of different institutions and organizations. This is not a easy problem to solve. So we've got to leverage the trusted institutions to begin with. One of my colleagues who I admire quite a lot, Ossi, who's the former head of the Kofi Annan Foundation and the International Federation for Red Cross and Crescent, always likes to say that communities trust the institutions who were there before the crisis, are there during the crisis, and stay after the crisis. The ones that parachute in are not the ones that the communities immediately respond to. So as we think about this response, we have to think about who are those institutions. And sometimes they're governments and sometimes they're not. Sometimes they're local or traditional structures. Sometimes they're faith organizations, places that people have found comfort and trust in for centuries. In terms of the playing nice, not playing nice, look, there's no way to look at this without seeing vaccine nationalism as one of the really, really stark features of this response. And there's been a lot of nation states that have done a lot and are providing a lot right now, but there's not a single instance that I have seen of a country saying, I'm prepared to slow down so that someone who's behind me can catch up. And maybe that's predictable. Maybe they're behavioral scientists and people who would have told us, or game theory or whatever, that that's the way that's going to play out. But for those of us who've grown up with a kind of commitment to justice ingrained in us, it's hard to accept. And it's a really important lesson for us from this response that I think we're going to want to really take into account the next time we have to respond to a crisis like this. There's a rich history of multilateral collaboration, and that history, when tested with this pandemic, didn't hold up the way that I think many of us had hoped it would. I think a lot of us thought there would be a global pool of vaccines that sort of was allocated to rise all the countries in an equal fashion, and that's not what's happened. Everybody's filled their cup, and then only after it's filled, said, I will start filling yours. And I think that's just a really important lesson for us to take from this response, and be realistic and prepared for it in the next one.
That's sobering, if not surprising. And I think the first step is clearly naming it. And you have named that, as difficult as that is to hear. Thank you for that. Liz, you guys at UNICEF are used to this collaboration thing. You work with lots and lots of different delivery partners. Do you have any words of wisdom or stories to share?
I don't know about words of wisdom, but I mean, I think, yes, I'd love, let me say this. I have never seen people working together globally like I've seen this year, with this last 2 years for UNICEF. So we've had, but although I do agree with everything Oren said, we've seen some, but let's look at 2020, when we really came together and came up with these products, these tools, vaccines, testing kits, treatments. We shared information and knowledge. Everybody came together. And then when we had vaccines, what Oren described happened. We looked after our own countries, and sometimes I'm Canadian, we purchased far more than we needed to even vaccinate ourselves 5 times over. We do have to remember, though, that high-income countries were hit hard. They have elderly populations. They were maybe hit harder and then initially. So I can see why these things happened. But I do think people are coming together, and we got to see when we worked together, it worked well. We had air transport companies coming to us and associations saying, we can't fly tourists, but what can we do to end the pandemic? Can we prioritize flights? Can we have some incredible arrangements from suppliers, manufacturers, private sector. We've never had so many philanthropists come forward and say, what can we do? And I think it really is in our interest personally to make sure this pandemic ends, because there's a sort of for all the game theory that Oren mentioned, I think we need to understand that where we have a situation of low vaccination and low healthcare in countries that don't have the funds to do that and the people, that is the perfect storm of creating a variant that will set us all back and have us back in this situation where we have another wave, another variant that we can't handle. So I like to think we're going to learn from this, and that we are learning from this. And I feel a little bit like as we move towards the end of this year, we're coming together a little better. And then on the ground, and Dr. Husna was talking about this, there's some amazing on the ground collaboration happening. And we need everyone. Look at what look at what social media has done about trust. Oren mentioned trust. Look at how important it is that every single player, wherever you come from, has a role to play in this. And I think this is a pandemic that touches every aspect of our lives. No one gets to say, this doesn't touch me. And no one gets to say, this isn't my company, my interests. They're doing fine. Anyone who's working in education knows that children have been out of school. Anyone who's, looking at social media knows we have terrible trust issues of misinformation clashing with information. So I think we need to learn things from this, because we've got climate change to tackle and we've got a lot of other things to tackle as well. But I'm pretty hopeful that we have seen what works and what doesn't work. So I guess I would end on that. And also to say that at the G20 last weekend, leaders of the world did commit to 70% vaccination for the whole world by the fall of 2022. And 40% by the end of the year. And I think we're going to start to see them coming together. And I hope others on this call agree. We just don't have any other option really open to us. We have to end this pandemic. And I'd like to celebrate towards the end of next year that we're out of it and that people are back to normal. Over.
I love the way that both Oren, you and you, Liz, have both spoken truths. And they're not contradictory. They are both true. There is a sober reality that is happening, and there is also hope. And if not for fundamental values, then enlightened self-interest is going to force us all to come to the table and work this out. Thank you both. I want to add one more layer into the mix of, Husna, when vaccines arrive in Eswatini, right? How is it decided who gets them and who allocates them? I can't imagine the ethical issues that are there on the ground in terms of vaccine equity and access. Can you speak to that?
Thank you. Just to add on to what Liz and Orion mentioned, I would first like to thank all the partners, donors, and stakeholders for their collaborative and continuous effort in reaching the 20% vaccine coverage in Eswatini, and now we're working towards 40% target by the end of the year. When the vaccines first arrived, we worked by vaccinating the vulnerable first. So we started by the healthcare workers and the elderly. And that was decisions that were made in technical meetings that are still ongoing. The incident management weekly meeting, the pillar meetings, including vaccination, risk communication and community engagement, infection prevention and control, case management, and there are so many pillar meetings whereby all these technical decisions are made, and also synergy of activities, different partners supporting vaccination teams with logistics, capacity building, and technical support. So these are efforts on the ground, ongoing, and a part of the interaction review that will be taking place very soon is to review our lessons learned from the activities that we're currently doing and how to improve. Over.
Thank you very, very much. And I want to thank all three of our panelists, both for joining us today and most of all for the work that you do and that your organizations do. There's a teaching in Mishnah Sanhedrin, one of the Jewish holy books, that says, one who saves a single life saves an entire world. You are saving many, many worlds. And for that, you have all of our gratitude. And I'm now going to speak a little bit how the rest of us can save the world, even if we're not a global health expert in the way that you are. I mentioned at the beginning of this plenary, UNICEF's Give the World a Shot campaign here in the UK. Olam partnered with the Office of the Chief Rabbi, with the Archbishop of Canterbury, and with Paris Foundation. And this goes really to what Oren was saying in terms of trust. People listen to those who trust. And so we knew we had to get into the local communities, and we thought that we could do that through faith communities. This campaign has been incredibly successful here in the UK, and Olam is now going to be working again together with UNICEF in the USA on an End the Pandemic campaign, which has a different name, but exactly the same concept. Give the world a shot, end the pandemic, call it whatever you want. We just need to get the job done. As Liz said, the reason that UNICEF was chosen as the partner for this campaign is because UNICEF knows how to do this. They've been doing it. They have the infrastructure all around the world as the largest humanitarian supply warehouse in the world. It's the only organization that has the infrastructure, the expertise, and the experience already in place, albeit with children, but that's easily transferable to adults. So they can and they are making it happen. So when people contribute to the Give the World a Shot campaign or the upcoming End the Pandemic campaign, those funds go to purchase vaccines, to prepare countries for vaccine arrival. We heard about refrigeration and delivery systems, all that needs to be done in advance. Those vaccines need to be transported. People need to be educated in the communities about those vaccines. And then they need to be delivered by trained healthcare workers so that those shots can get into arms. UNICEF has been involved and is currently ramping up all of those efforts around the world. Why is Olam involved? Well, we are an umbrella organization that has so many different partners, and we feel passionately that we can take on this global issue and we can move it forward in terms of our relationships with the Jewish community to get the word out. It's a moment for the global Jewish community to step up. Most Jews in most countries have had access to vaccines. Most of us have even had access to booster shots or will have access to booster shots for free. We've been able to return to a somewhat normal life, and it's now time to pay it forward so that others can also live without the fear of getting sick, and so that we all can live without the fear of variants that will overcome the miraculous vaccines that we do have. We truly are not safe until everyone is safe. And this goes to another Jewish value, pikuach nefesh, fundamental principle of preserving human life. It's a principle that overrides virtually all other Jewish commandments. It is a core Jewish value. And that is one of the reasons that Olam is asking Jews around the world to be involved in these campaigns and for all of you to help get the word out. You can do one of two things. You can either donate today, and I believe there's going to be a link in chat for the UK Give the World a Shot campaign. If you use the Olam specific link, then it will come up as in the metrics as this was part of the Jewish community. And I think it's really important that people know that we're giving because we're human, but also that this is a Jewish value to do this. And so by clicking on that link and using that link, as opposed to going through another link, you'll be sending that message that the Jewish community cares about global vaccine access and equity. The US-based campaign is going to be officially launched in January. Please be in touch with Amy Weiss at Olam to get yourself or your community involved with it, and to help spread the word about how all of us together can help create a more equitable and healthy world. Save a life, save the world, and we can do that together. Thank you, Oren. Thank you, Liz. Thank you, Husna, for being with us.